so we have discussed and collaborated with many of the signatories of the articles that you have mentioned over the last few months. And indeed, we discussed the available evidence that has been discussed in these pieces. And also, we received contributions from many of the signatories of these pieces. We acknowledge that there is emerging evidence in this field, as in all other fields, regarding the COVID-19 virus and pandemic. And therefore, we believe that we have to be open to this evidence and understand its implications regarding the modes of transmission and also regarding the precautions that need to be taken.
Would you like to add something, Maria?
Just to say, thank you, Benedetta. Just to say that, yes, you know, we have been engaged with this group since April, when they first wrote to us on April 1st. And we've had an active engagement with them and with many of the signatories on this through different networks. And as we have said previously, we welcome the interaction from scientists all over the world, from many different disciplines. Many of the signatories are engineers, which is a wonderful area of expertise, which adds to growing knowledge about the importance of ventilation, which we feel also is very important. We have been talking about the possibility of airborne transmission and aerosol transmission as one of the modes of transmission of COVID-19, as well as droplet. We've looked at fomites, we look at fecal oral, we look at mother to child, we look at animal to human, of course, as well. And so we are producing a scientific brief on summarizing where we are. We've been working on this for several weeks now, and we've engaged with a large number of groups, epidemiologists and clinicians, IPC specialists, engineers, mathematical modelers, to try to consolidate the growing knowledge around transmission. But we have spoken about the importance of all of the different potential modes of transmission. This is a respiratory pathogen, and so it is important that what we know fits into the guidance that we have, which is why a comprehensive package of interventions are required to be able to stop transmission. This includes not only physical distancing, it includes the use of masks where appropriate in certain settings, specifically where you can't do physical distancing, and especially for healthcare workers. So our focus on the use of masks, of course, is for healthcare workers, and to use airborne precautions where you have those aerosol generating procedures. But we're also looking at the possible role of airborne transmission in other settings where you have particularly closed settings where you have poor ventilation. So we will be issuing our brief in the coming days, and that will outline everything that we have in this area.
I would like to highlight that we encouraged and supported research in this field as well. You highlighted the hydroxychloroquine or the treatments field of research, but we have supported research in this field as well. And indeed, last week, as you may remember, we held an international research meeting where there were active discussions on infection prevention and control and modes of transmission. And our group, together with the experts who are part of it, really highlighted the importance of research in the field of different transmission routes, and in particular through droplets of different sizes, and understanding really what is the relative importance of this. And also understanding the dose of the virus that is needed, in particular in this route of transmission that is the aerosol or airborne transmission. So these are fields of research that are really growing and for which there is some evidence emerging but is not definitive. and therefore the possibility of airborne transmission in public settings, especially in very specific conditions, crowded, closed, poorly ventilated settings that have been described cannot be ruled out. However, the evidence needs to be gathered and interpreted, and we continue to support this. Regarding the measures that you were talking about, yes, indeed, we do recommend a number of measures like those mentioned by my colleague before, which take into consideration this possibility. In several of our guidance documents, we do recommend as much as possible avoiding closed settings and crowded situations. We do recommend appropriate and optimal ventilations of indoor environments, and also physical distancing, as you know, and when this is not possible, in areas with community transmission of the virus, we recommend the use of face masks, in particular fabric, non-medical masks for the public. So all of this is taken into consideration in our recommendations, as we previously said.